Hello, my name is Dr. Kelly McGlothem-Bell, and I'm a recently appointed assistant professor at the UT Health San Antonio School of Nursing. I recently completed a postdoctoral fellowship with Dr. Lisa Cleveland of the School of Nursing.
Hello, I'm Dr. Pam Recto, a postdoctoral fellow through the Center for Research to Advance Community Health. My mentor is Dr. Lisa Cleveland from the School of Nursing at UT Health San Antonio.
Did you know that approximately every 15 minutes in the United States an infant is born withdrawing from opioids? Unfortunately, we know that here in San Antonio, Texas, approximately 1/3 of the infants born exposed to opioids, those births occur here in San Antonio. What we seek to better understand is how we can improve health outcomes for the mothers and infants that we serve in our community. Unfortunately, we know that prenatal opioid exposure is an early life stressor for our infants, and this stress can have long-lasting impact for mothers and infants, including both physiological and epigenetic changes. What we seek to understand is how mothers and infants interact when they are under stress and how we can better improve health outcomes for them.
Another one of our research purposes is to understand how stress impacts pregnant and parenting women with opioid use disorders. And so for this part of the research, we want to examine maternal stress physiology. And so we usually recruit women when they're in their third trimester. And when, after consenting the participants, we ask them to collect their saliva for us over 2 days. And what we're doing is measuring the cortisol levels in their saliva. Cortisol is a measure of stress, and so we want to understand their stress levels over the course of 2 days. In addition to that, we ask the women to fill out some self-report measures of maternal health, perceived stress, social support, substance use, and emotion regulation. And all of this collectively is helping us understand how stress impacts pregnant and parenting women with opioid use disorders.
During my time as a postdoctoral fellow here at UT Health San Antonio School of Nursing, I had the wonderful opportunity to work with Dr. Lisa Cleveland in her research. I was very blessed by my mentoring experience with her, in that she really took the time to understand what my needs were as a student and postdoctoral fellow, but also the goals that I had as a researcher. And so now as an assistant professor here in the School of Nursing, I hope to do the same for my students and offer them the same leadership, but also experience that I had, where they feel that they are a valid member of the team and can go on to conduct their own research.
As a maternal child nurse, I've had over 15 years working with parents from various populations and various ethnic groups and racial groups as well. My commonality with Dr. Lisa Cleveland's work is that we both focus on maternal mental health and behavioral health, specifically with opioid use disorders. And my research focus has primarily been with adolescent mothers and their mental health. And very recently, I realized the need to include fathers in this narrative in order to address the well-being of families. This postdoctoral fellowship has been monumental to my work, not only in addressing opioid use disorders in pregnant and parenting women, but also addressing the salient health needs of fathers as well, as they are often ignored in research and even in service delivery. So it's an honor for me to work at the School of Nursing and also to work with Dr. Lisa Cleveland.